Good morning, everyone. I'm delighted to welcome you to our webinar this morning. I'm Tom McLean, Head of Research and Social Policy at Uniting in New South Wales and the ACT. I'd like to begin by acknowledging the Gadigal, the traditional owners of the land that I'm joining from today. I'd like to pay my respect to their elders past and present, and to acknowledge the traditional owners of the lands that you are all joining from. There are many of us here today, too many to acknowledge each of them individually, but it's important for us to remember that connection and to remain grounded in that connection to country. Today, we'll be exploring the role of social capital in family life. This was the subject of our most recent Uniting Families report. It takes a village to raise a child. We'll be doing three things together today. I'm going to start by making some brief introductory remarks about the report to give us some context. And then we're going to hear from three groups of colleagues from across the Uniting Care Australia network about their experiences of working on the front line in this space. And then at the end, we'll have time for questions and answers. And while you're hearing these presentations, it's okay for you to post your questions in the chat. Our team will be monitoring the chat throughout today's event, and then I'll read the questions out on your behalf and facilitate a discussion. So without further ado, let's get underway. The Uniting Families report is a 10-year project exploring family life in Australia. It's a partnership between several members of the Uniting Care Australia network on the one hand, and the University of New South Wales' Social Policy Research Centre on the other. Families are a fundamental social institution. They have important roles to play in the process of raising children and in addressing and sometimes, unfortunately, entrenching disadvantage. Now, you may think, why bother researching the family like this? Families are familiar to all of us. It's because our political discourse, our social policy, and our social service design in Australia have tended to ignore the complexity and the diversity of families. And this has happened in ways that perpetuate disadvantage for the most vulnerable members of our society. And we aim to change that. So each edition of the Uniting Families report does three things. It celebrates the diversity of family structures in Australia. It explores how families raise children and how these practices vary across family type. And it analyses the access to resources, opportunities, and supports that families have as they carry out this role. We want each of the reports that we're producing over the next 10 years to contribute to evidence and informed debate, to be useful for practice, for innovation, for advocacy, not just here at Uniting or the various Unitings, but across the sector, and to help us all drive system change. Today, we're going to be hearing or exploring the theme of our second edition of the report, which we published in September last year. This report explored the role of social support networks in the lives of families raising children under the banner that we've all heard as a phrase repeated many times, I'm sure: it takes a village to raise a child. I'm not going to spoil your pleasure in reading the report by giving you an overview of everything that we said in it. It's a great report and it's very rich. Instead, I just want to offer observations on two things to frame our discussion today. The first is, what does the research suggest is the relationship between services and the village in the lives of families in Australia? And then the second is, what might we learn by applying those insights to the way we've designed social policy in Australia today? Our research suggests that the village has a complex relationship with services. The village is a relational ecosystem. It grows and evolves slowly over time as individual people meet and interact. It's built on mutual recognition, on trust, on care and reciprocity. Those of you who've read Putnam will recognise social capital in this. We also heard that people value services like GPs and disability supports and early learning services and sometimes even child protection caseworkers, but they don't generally see the services as part of their village. However, families did describe schools, playgroups, and community centres not simply as service providers, but as places of connection, where they felt known, where they felt safe, and where they felt part of something larger. In other words, some kinds of services can help families to build and sustain their own villages, even if they don't always see the services as part of their villages. And sometimes people working in those services could, on rare occasions, become part of the village when they played an important and an ongoing role in people's lives. Now, if we turn to the way we do social policy in Australia, at the highest level, policymakers recognise that the village exists. but really only in a kind of indirect and a fragmentary way. It's a bit of a blind spot, in other words, and to oversimplify, it's seen mostly as a means to an end and not usually prioritised as an end in its own right. And there are three ways I think we can see this. Some social policy announcements explicitly recognise the village as useful. It's a way of ensuring vulnerable families find the supports they need, for example. And we can see this in the Commonwealth Government's recent announcements about Thriving Kids, which talk about providing supports for eligible families in the places that they already go. However, the kinds of services which help families to grow their villages are generally not a high priority, and that role is generally not a high priority even for those services as designed. These sorts of spaces tend to be local community areas where people raising children gather with others at a similar stage of life, not exactly spontaneously, but because they want to be there. I'm thinking of things like playgroups and libraries and community centres and parents groups. These kind of services are often called early intervention. And as I'm sure everyone on the call here knows, they often struggle with funding. They're vulnerable to cuts when times are tight. And even when times are good, they tend not to be the recipients of government largesse. But they're incredibly important. And the third observation is that in Australia, lots of our policy is moving in the direction of individualised funding models, and they don't really help. They're popular with policymakers because they give fine-grained control over who gets the money and what they get it for, and they make sure that that spending is at least on paper aligned to individual need. But they're a poor fit for the kind of work which helps people grow villages. That takes time. It doesn't happen smoothly. It requires deep and ongoing engagement. These are things that are at odds with the kind of to-do list, short-term interaction approach that individualised funding tends to encourage. So villages are important. They have a complex relationship with services, and the way we design services at the highest level doesn't really help the village. It's now time to hear from three groups of my colleagues across the Uniting Care Australia network about what it's like to be on the front line. What does it mean to support vulnerable people to find and grow their village? And how does it feel to work within the contradictions and the constraints of how Australia does social policy that I've just described? And to start with, I'd like to hand over to Natalie Worthington. Natalie is the Manager of Child and Family Services at Uniting in Victoria and Tasmania. Natalie.
Thanks, Tom. I'm going to share my presentation. Great. Thanks, Tom. As mentioned, my name is Natalie Worthington, and I am the Manager of Child and Family Services in the metropolitan eastern suburbs of Melbourne. I also would like to acknowledge the traditional owners of the land. I'm currently on Wurundjeri country, and I pay my respects to elders past and present. Today, I'm going to highlight our program, our Early Help program, which is a time-limited early intervention program that can meaningfully strengthen parents' capacity to provide safe environments for children, as well as support parents' empowerment, self-efficacy and confidence that is accessible within the community. Early help has been established to address some key challenges that were identified in the community. So services within our community can often operate in silos. Families genuinely don't know what's available to them for support. Universal services such as schools, kindergartens, maternal child and health centres are often unaware of what family supports exist and how to access these services for the families that they work with. There's a cohort of parents who don't often meet the threshold for family services, but could benefit from some additional support, and we refer to them as the missing middle. And often there is a stigma about accessing parenting support that can prevent parents from seeking help until they're in crisis. So we know that early intervention that builds parents' capacity and family functioning can reduce the risk of child abuse and neglect. And there's emerging evidence that indicates that a universal approach, as opposed to a targeted approach aimed specifically at disadvantaged populations, can help reduce the prevalence of child abuse and neglect at a community level. So what does our program do? So our support with families can be one-on-one with short-term case management. And we also offer evidence-based parenting support groups as listed on the slide here. Families can access one or both types of support, and we have a small amount of brokerage that assists families to meet their goals. The program has been built around being co-located within the universal services to provide direct access for consumers. We co-locate at a number of primary schools, kindergartens, and maternal child and health centres across eastern Melbourne, which enables us to support families with children between the ages of birth to 12 years. To enable us to understand the evolving needs of the community, we regularly distribute parental surveys within our services to determine what type of support is needed and the preferences on how they can be delivered. So they could be face-to-face or online. Are they needed during business hours or after hours? And we offer a combination of these options to meet families where they are at. The surveys was how we identified an interest in expanding our evidence-based parenting groups to the number that we have on the screen there. And through the surveys, we identified a need for a therapeutic, local and low-cost group for children that addressed social anxiety and promoted friendship building skills. So that's how we added the Treehouse program, which helps us to respond to multiple needs. The Early Help program has helped to overcome some of the challenges identified by using a child-centred, family-focused model that delivers integrative supports that's embedded within established universal services. We have developed strong relationship with our partner services, and through co-location, we've been able to provide local access points so that families can access supports in familiar environments. It aims to reduce the stigma in accessing supports. It promotes help-seeking behaviour and ensures that we're reaching those who need support by meeting them where they're at. Support from the universal services that we partner with is essential in the great outcomes that we have seen for families. So one example of what we've seen, a case study example, we were able to provide support to a family who were referred to us by a primary school. The family had 4 children, all who had additional needs. The eldest child was in grade 6 and had been diagnosed in grade 3 with an intellectual disability and ASD. However, no supports had been put in place for them. The family were keen to engage in services and were really strong advocates for their children's needs, but they didn't have the knowledge or the financial means to access support. So the Early Help program assisted the family with navigating NDIS, linking the parents with counselling and psychosocial support. We funded a learning assessment and psychology for one of the children and supported the school to develop a plan for the eldest child's transition into high school. So this is a really great outcome for that family. Quantitative data, as reported by parents and gathered using the Me as a Parent scale, sees the largest shifts reported in the area of self-regulation and emotional management. The finding indicates that the program equips parents with both emotional regulation skills and the practical systems and service access knowledge to help parents feel that their situations are manageable. Our group sessions produce dramatic changes in certain high impact domains, and individualised support delivers consistent, evenly distributed improvements. Having a consistent presence in the universal services has enabled us to start destigmatising access to support, as we've become a familiar part of the services that is already entrusted and known within the community. Our program has worked with over 1,200 families since the beginning of the pilot in July 2022. We have a very small FTE of 4.4 staff, so we see ourselves as a small but mighty program that has a wide reach within the community. And lovely, we continue to receive feedback from families that we've worked with early on in our pilot, and they talk about the positive trajectory that their family has experienced as a result of working with our program, and it's really lovely to see. Thank you. Back over to you, Tom.
Thank you so much, Natalie. I think there are several things in that I didn't speak about when I was referring to our research before, but that really resonate. The aspect of connection with peers through these sorts of groups, but also the destigmatizing by meeting people where they are, is so important. And I hope we might be able to explore that a little bit later in the Q&A. But before we go there, we've got two other presentations that we need to hear from. I would like to introduce you all to my colleague here at Uniting New South Wales ACT, Courtney Baker, who is a regional manager in our services in southwest Sydney. Courtney.
Thanks, Tom. Sorry. Thank you all. I would like to acknowledge that I'm calling from Darrell land today in southwestern Sydney and pay my respects to elders past and present. So I'm going to be talking about Village Connect. So Village Connect is an early intervention program supporting parents in southwestern Sydney. It's a partnership between Uniting New South Wales ACT, Karitani and Sonda. Each organisation brings different expertise, parenting support, health and wellbeing, but families experience it as one connected service, not separate parts. As it all started with something that parents told us very clearly, that they didn't have a village. In southwestern Sydney, many of our parents are experiencing vulnerability early in their parenting journey. They may be navigating housing stress, financial pressure, relationship challenges, or managing their child's health or developmental needs, and often they're doing it alone. At the same time, the service system that they're meant to rely on is often described as complex, fragmented, and difficult to navigate. So families are left trying to coordinate multiple services, retell their story again and again, and advocate for themselves, often at a time when they're already overwhelmed. We know that when support doesn't come early, outcomes can escalate for both parents and children. And the question we asked was, how do we create something that wraps around families early in a way that's relational, coordinated, and actually feels supportive? And our response to that was Village Connect. Village Connect is built around three core elements. So first, a dedicated key worker through Uniting. Every family is matched to one consistent person who walks alongside them over time. This is not short-term case management, it's long-term relational support. Key workers link families to the right services for their needs, help navigate systems like housing, health, NDIS, advocate for parents and support them through challenges, and most importantly, set goals based on the parents' hopes and dreams for their future. They also provide practical coaching and mentoring, meeting families where they are and moving at their pace. At the core of this, it's walking alongside families, not just stepping in and out. Secondly, a child and family health hub through Karitani. This is a welcoming, safe space where supports are brought together in one place. Families can access supported playgroups, parenting programs, speech and occupational therapy, as well as education, employment, and wellbeing supports. The key difference here is that parents are not handed a list of referrals and expected to navigate it alone. Instead, supports are coordinated around them and connected in one space. Third, a 24/7 digital support through Sonda. Families can access health professionals at any time, day or night. This includes support for general health concerns, feeding and settling, safety and mental health concerns, the ability to connect via text or phone and speak to a qualified clinician quickly. One mum described it as having an angel in her pocket. Access to Village Connect is intentionally simple. Families can come through referrals, self-referrals, or word of mouth. We operate on a no wrong door approach. Wherever a family enters, they can access support, and they can use one part of the model or all parts, and they can stay involved as long as they need. What makes Village Connect different is just not what we offer, it's how we work. We're family-led. Parents set their own goals and define what matters to them. They are recognised as capable and resourceful. We talk to families about their hopes and their dreams for their families, and we go from there. We invest in relationships. We know that trust doesn't happen quickly. It's built through consistency, reliability, and showing up, especially on the hard days. Because when trust is there, families feel that they can be safe, and that's when honesty happens. And honesty is what creates real change for our families. It's holistic. We support the whole family system, not just the child, because you can't support a child in isolation from their parent. And finally, it's integrated. Our professionals work together behind the scenes. Key workers, therapists, health education officers, family coaches and support staff all communicating and coordinating care. The families don't have to carry the burden. They don't have to coordinate the system. The system coordinates around them. To bring this to life, I wanted to share a brief story. One parent came into Village Connect feeling like she had no purpose and initially didn't want support. Over time, through a consistent key worker relationship, things began to shift. She started setting goals and achieving them. She accessed housing support, education pathways, and services for her child's development. Today, she's not only engaged in the program, but she's also trained as a peer facilitator, supporting other parents going through similar experiences to her. She described her earlier experience of the services as feeling as though she was just constantly waiting and getting nowhere. But with Village Connect, she said that she felt like things were happening. I felt the village was always being proactive, and that's exactly what I needed for my family. Village Connect exists because young parents told us they didn't have a village, so we built one. Not just a program, but a connected relational system of support that wraps around families early and meaningfully. Because we walk alongside families at the right time and for long enough for trust, confidence, and connection to grow. We're not just supporting them in the moment, we're changing long-term outcomes for families. Thank you.
Thank you so much, Courtney. There's so much in that mimics, or that not mimics, I'm sorry, that reinforces the findings of the research. And there are two things in particular I want to draw out, because again, I'd love to explore this with you in the Q&A later. One is the importance of meeting people where they're at in terms of their phase of life. We know that the role that the village plays in people's lives evolves over the life course. And sometimes people need things from their village and sometimes they contribute back. And I heard that very strongly in what you were sharing with us about the different ways people draw on and contribute when their children are young. And the other thing is the importance of this being fundamentally relational, first and foremost. We build a relationship and we stick with people over the long term, and then we figure out a way of helping them with their issues. That it's about honouring people and relationship first. Both incredibly powerful. And I hope we get some questions on how you guys do that in the chat so we can explore them when the time comes. But before we get there, I'd love to introduce you to two of our colleagues from Uniting in South Australia. Kitty McLean, who's the Senior Manager of Child, Youth and Family Services, and Nicola Bennett, who's the Program Coordinator of Community Capacity Building. Kitty and Nicola.
Thank you, Tom. I'm Kitty, and sitting next to me is Nicola. I would like to acknowledge that we are meeting on the traditional lands of the Kaurna people and just pay my respects to elders past, present and emerging. We're just sharing our presentation. So we're going to talk to you today about a program that we deliver in partnership. It's called the Western Perinatal Support Group. As the facilitating partner, UnitingSA partner with Central Adelaide Local Health Network to deliver a perinatal program for mothers either with postnatal depression or at risk of developing postnatal depression. These mothers are also at risk of their babies entering the child protection system. The program is delivered in an accessible and inviting church hall in the Western region of Adelaide. It's funded via the Communities for Children program, which is a federal funded program via the Department of Social Security. The program itself is delivered by a mental health nurse and a clinical psychologist. There are two components to the group. There's two group programs that run consecutively over 2 terms, a Circle of Security and Postnatal Depression Anxiety Therapeutic Group. A creche is provided by UnitingSA staff alongside the sessions. Mothers also access a playgroup with their child at the same venue on a different day of the week. Women can self-refer or are referred via their GP or other health practitioner, and at least one child needs to be aged under 2. There's a comprehensive assessment and standard questionnaires are completed prior to and following attendance at the programs. And you can see on the slide there some of the clinical presentations. Why intervene? We know the prevalence of new mothers suffering from depression and anxiety is quite high, approximately 20%. The impact of the untreated maternal mental illness on the infant can be significant. It's well recognised there's detrimental cognitive, social and emotional development. So investment in place-based initiatives such as this one helps families and particularly mothers to strengthen their villages. This program provides the environment for the mother to find connections, build trust, support, and a feeling of being in an authentic relationship with others. As it's pointed out in the It Takes a Village report, the true value of these community place-based activities is often not well recognised. But we know that by creating opportunities for the mothers to connect and learn together, improves their mental health and their ability to care for their children. And it's an opportunity to break the impact of transgenerational trauma. And we know early intervention works.
So over to me now. Thank you, Kitty. So what do the 2 programs consist of? They're complementary programs run over 2 terms, and the one of the groups covers postnatal depression topics relevant to the mums. So dealing with uncertainty, there's an element of CBT, challenging negative thinking, being assertive in the family, managing anxiety and stress, etc. They're both evidence-based programs. And the other part of the second part of the program is Circle of Security sessions, which cover, as it says on the slide, being with infants, the path to security, exploring struggles, and alongside that therapeutic intervention program, there's a weekly play group that provides mothers with additional opportunities to engage in positive play with their children, develop parenting skills, strengthen attachment and build confidence. The creche runs alongside within the same space as the programs, so support mothers when they need that, when they're receiving particular interventions or discussions with staff, and support the children and to build mum's ability to interact and play with their children. In addition to the therapeutic program, at the playgroup, the mothers can build on their friendships that are developed within the program, as well as other attending families. So the playgroup is open to families in the area, which then provides support systems within their communities, reducing isolation and strengthening ongoing positive mental health. So there has been a review of the programme over a long period of time. The programme's been running for over 15 years in a very successful collaboration. And the data from 2007 to 24 was analysed and evidenced that there was increased mother-infant attachment, there was reduction in depression and anxiety symptoms, and that participation in one or either group or both groups were equally effective in improving anxiety and attachment scores. So the participation in the programme was associated with statistically significant improvements in depression and anxiety symptoms and mother-infant attachment scores. And I just wanted to give a quote from one of the recent participants who said that within the group, to a member of staff, I just have to tell you, this group is like oxygen for me. It feels like the only time during the week I don't have to perform, and I don't have to prepare anything. I just come, you give us snacks and coffee, and we're able to talk about whatever's on our mind, and that's okay. I feel no judgment, just support. If my baby cries, I don't feel like playing with them, or I need to go to the loo, I'm supported. And I think one of the important things here, and it talks about, I guess, the simple thing of giving snacks and coffee, but it's also an environment for mums to feel safe, to feel they can talk about their challenges in a supportive environment, and also they're cared for by the staff. And I think that's really important. That sort of interaction, that simple act of making a coffee or having cake and sharing that with others is also an act of caring for those mothers as well. And just as a final note, a lot of the mums come to the group, and when they're referred by health professionals, where there are child protection elements as well. There's concerns of a child protection nature in relation to attachment and in relation to the care these children receive. And over the period of the programme has run, there have been a significant reduction in child protection concerns for children, and only one child was referred to statutory agency and was removed for a short period of time from the home, and they were successfully reunited. So in that sense, it's also enabled children to develop positive relationships with their families, reduction in child protection concerns, and improvement in mum's ability and family's ability to provide that adequate and good enough parenting for those children. Thank you. I'm just going to hand back to Tom now.
Thank you so much, Kitty and Nicola. Three incredibly rich and inspiring presentations. I've heard some of this material before, but to hear it now live with all of you guys presenting, even I'm thinking, yeah, we as a society don't do enough of this, and we should do more. They're great. We have now reached the time for questions and answers, and I can see that the chat is running hot, but it's not yet running hot with questions. So I'd like to invite everyone who's here on the webinar to feel free to add comments or questions in there. And while we're waiting for you guys to act on your inspiration, I have a couple of questions that have come to me from common themes in the presentations that we've heard. We're about to go off-piste. We've not practiced this part of the webinar, so I promise I'm going to be gentle with you, friends. One of the themes that has come from all of the presentations is the issue of, in various ways, stigma and belonging. That the need to provide spaces where people feel safe enough that they can discuss their problems and the issues they're working with, but also safe enough to actually turn up at the door. The challenge of acute services to deal with some of the quite serious mental health problems that we've heard about, for example, is often that people don't want to go there because they don't want to see themselves as having that problem. I'm going to turn to Natalie first, because I think you were the first in our of our presenters to use the word stigma, and to ask you maybe to offer some more comments on how that issue of stigma presents itself and the choices that you make and that your service makes every day to confront them.
Thanks, Tom. Yeah, look, I think that's a very good question. I think that our frontline practitioners, see that in the families that they're working with, that, particularly in the early intervention space, that a lot of our services are more aimed at, pointier ends of families being struggling. And so families don't necessarily want to identify themselves or don't identify themselves with needing that sort of level of support. So I think the benefit of this program is that, one, being co-located in services that they already are familiar with and are comfortable with, have that trusting relationship with, and turn up to sort of every day, thinking about primary schools and kinders, that, yeah, it's a lot less confronting to sort of say that we need help and need support, and rather than waiting till it gets to the point where it's, real crisis point and having to engage with some of those more stigmatising services, like going through the orange door or going through child protection.
Thank you. Courtney, I know that that Village Connect deals with this in a slightly different way because of the combination of online and in person. What's your experience in Southwest Sydney of that?
I think for us, it's around, we're a hybrid hub. We have some people that are based in the office and obviously key workers that will travel around. And I think for us, it's being able to meet families in their homes and being able to talk to them around things that are happening for them in a way that is less confronting than it being in an office. We have some soft entry approaches. Some people can just show up to play groups and they will have a mixture of key workers and staff there, so we can just start to have really, I guess, soft questions around what's happening for them. And some of our parents might just come to playgroup a couple of times and then want a key worker, and they can meet them at playgroup and have those conversations. So I think for us, it's being really mindful around taking the parents' lead around what they want for themselves and what they want for their family and at their own pace. And that might just be popping into playgroups and then having a key worker come along. So I think, yeah.
Thank you. Kitty and Nicola, I'm going to, rather than throw to you to talk about stigma as well, I'm actually going to ask you a different question, because the rigour of the evidence that you guys presented, and Kitty, your role, I think, will mean that you probably have a very interesting perspective on this one. So the question is, what do you think, if you could ask government to make a change in policy or a change in funding, what's the big ask that you'd bring to enable a shift to the village mindset in these kind of services? What are we missing as a society?
It's a very good and complex question, Tom, but there seems to be easy answers, but they seem to be difficult to implement, I think. I spent a lot of time in state government in South Australia, and what I found is state and federal governments operate in silos in their funding streams and how they fund these sorts of programs. And I don't see a lot of crossover in how they fund programs. Certainly here in South Australia, we see significantly more investment at the higher end of interventions, so for more families that are at risk. And certainly a lot of the funding goes into child protection services or out-of-home care services. So unfortunately, we know that early intervention works, the research is there, yet we still seem to be slowly, I guess, getting that point across to governments that if you invest at the front end and you work with these families in place-based and in their own community, they are less likely to be requiring statutory services. So I think we need certainly bipartisan support, but we certainly need federal and state governments in a, I guess, joined up approach.
Yes, the silos are an important barrier to this, and there have been a couple of comments in the chat that I can see where people have called those out as well, so it's definitely a theme. I wonder if I might ask either Natalie or Courtney to chime in on a different aspect of the silos and a different shift, but it's one that's related to the question I just asked, which is the challenge of your practice on the ground integrating with other services. Both of you, I think, but you in particular, Natalie, mentioned working with universal services as part of your practice. Those silos are held in place by high-level policy things, but in the end, it's people working in the community who actually deliver the services. So I'd love to hear your experience of working to overcome those barriers and integrate.
Yeah, sure. Look, it started, quite slowly when we started working and co-locating at the universal services, but I think that consistency of being there once a week, regular days, and supporting connecting with staff members at these services and really enhancing their knowledge of service system access as well has over time really built strong relationships, and we're a very integral part, I guess, of the services that we co-locate with. But yeah, it took a couple of small wins at the start to really establish what the service was, what we could do for families, because it was a very unknown. It was even sort of unknown to us. It was a pilot program. So yeah, once we sort of got a few small wins under the belt at the start, it really sort of took off. And just being, as I said, the consistency of being there on a regular basis really built that relationship and that foundation. And yeah, it's very strong now. Yeah.
Thank you. Courtney.
I agree with everything Natalie said, but I guess for us, we have spent a lot of time looking at how we're 3 large organisations and how do we then kind of put some of our stuff aside and just focus on a shared vision, which I think is always easier said than done when there's lots of policies and practice that comes along with that from all organisations. But I think we have got to a point where we have this shared overall vision for what we would like to deliver for our families and what our families should receive from us as services in our area. And I think we come from a very multidisciplinary team. We've got people who have lived experience, people who are different versions, health professionals, social workers. But I think we've really come together that we all bring something so very different. And that when we come together, we can create this nice wraparound service for families. And I think the biggest feedback that we've got is our families don't know the organisations we work for. They know that we're Village Connect, and they just see us like that, which I think is the biggest testament to our integration with each other around families know that they can go and they can speak to somebody at Village Connect and they'll get what they need. And who does that and what organisation pays for it, or what does that look like is ours to navigate, but families don't feel that. So I think that's really important for our integration.
Yes, the fact that the family doesn't know all of the busy work going on behind the scenes is critical. Nicola, I think I understood in your presentation that UnitingSA has brought together a range of services that it already provides in the program that you described. And so that angle of integrating within an organisation struck me as interesting. Did I understand you correctly? I wonder if you could talk a little bit more about the process by which you assembled the model as it currently stands.
Thanks, Tom. Yes, we do. We have some staff within UnitingSA who provide creche services, and we also collaborate with Playgroup SA, who provide the playgroup that runs alongside the program, as well as a long-term collaboration with the local health network. And I think, as well as the services that we sort of co-locate and we run together to support women who are involved in that program, we also refer and signpost parents and mums that attend those groups to other services that may be able to support them with specific issues or needs that they have. And I think it's about providing sort of, I guess, more wraparound care and service and support to those families rather than just one standalone service. And we think that works really well in providing not only the children with care during the attendance at the program, but also providing the mums with the care and the input that they need to be able to develop their confidence, develop their ability to attend and access other services externally. So we found it's a really good partnership across those various services to support mums to really be able to parent better and to be able to develop their mental well-being in the short and longer term.
Right. The reason I ask you that question is that I want to pick up on one of the questions that's been asked in the chat. I wonder if, as you were building your service, building your model, you came across specifically narratives and mindsets in the system that needed to be overcome? Because what I'm hearing is each of the individual pieces is demonstrably effective, and the idea that we might want to help families better, nobody's ever going to disagree with. Is there a narratives and mindsets piece that's holding us back from doing this better across the board? And how did that present itself for you?
Kitty, you got any comment on that? I think, as I said earlier, I think there's certainly challenges in terms of funding. I note that a couple of people have already mentioned in the chat, and I think it's Natalie's program that is started as a pilot program. So these programs often start with very limited funding, and they're pilot programs, so that generally means there's limited funding for evaluation purposes, which then helps you to demonstrate your evidence base. So you're setting up the programs to help people really at the front line, but then there's really limited other support or other, I guess, funding that sits around that to validate your program and then come in and say, look, we know that this works. So I think that, you know, hindsight's always wonderful. You'd like to be able to build those sorts of things in as part of your funding, whether it's an agreement or however you've set up your pilot program. And, you know, I spoke about it last week. Communities for Children is federally funded, but the federal government are now looking at sort of redesigning the funding arrangements. So we've seen an extension from July this year to to January 2027, and now just another extension until July 2027. So you know, it's very small steps, but that then leads to uncertainty in programs, it leads to uncertainty for staffing, and it certainly leads for uncertainty for the program that we know has a really substantial impact for mums in our area. So they're the things that I think, you know, you'd want to have a bit more guarantee around your funding, and you'd want to be able to build in evaluation capacity and also capacity to grow your service.
Yes, I think your last point is really well made and is very close to our research findings, that these services are a little bit the poor cousin. I mean, that's not a research finding, that's just what we know. But the kind of outcomes that we're achieving here are difficult to integrate into a policy mindset that sees solving individual clinical problems as the only goal.
Mm.
I wonder if I might change direction a little bit in my question and explore a different theme with you all now, and it's the theme of connection. We've heard a lot about the way in which the three services interact with clients, if you'll forgive me for kind of using that language, that framing. How do we build a long-term relationship with them? One of the markers of a good social service is that the change that we achieve in people's lives is maintained after they move on, change in their lives outside. And so I'd love to hear from each of you. I might start, Courtney, with you around how we in Uniting New South Wales ACT support people to build and maintain strong relationships that they then carry into their lives after they've moved on from Village Connect and no longer feel like they need that kind of support.
Sure. I guess our model is unique in that we can work with parents for as long as they like. So we've had some families in our program for about 2.5 years. And we have been fortunate to be able to walk alongside some of our parents from, you know, the time that they find out that they're pregnant all the way through to their child's first birthday. So we've been able to step them through that process, and our model is really built on coaching and mentoring. So doing alongside families so that when they are ready to leave Village Connect, or I guess they feel like they no longer need any support, we've been able to build those real foundational skills. And, you know, some of that coaching and mentoring can be helping meal prep before baby's born, or going to housing and talking around what actually they are entitled to, or pushing back on their landlord when, you know, that their sink's not getting fixed, or whatever that looks like for families. And we've been able to see that when we can do that over time and we do that consistently, that families at the end are far more confident. And I think for me, we had a mum, we got her referred when she was about 6 months pregnant, and we walked with her through that journey. And in the end, she made a complaint on her own behalf because she felt that she wasn't getting what she needed from a service provider. But for her 6 months ago, there was no way that she would have done that. So we know that through that consistent ability, and it's long, like none of our early intervention programs in New South Wales are long term. Like we're working with families for 2.5 years. That's incredible amount of time to be able to be alongside a family to really help them build their confidence and their resilience to be able to do all of those things for themselves when they leave.
I love that your example of a good outcome is that she got a bit bolshy. That's good trouble. I like that. Nicola, what about from your experience?
I think, sorry, I'm just going to jump in there, Tom. I think one of the really successes of the program that is probably really difficult to quantify is that a lot of the mums after the program continue to stay in touch with each other and go out for lunches and coffees and things like that. And so that support across that cohort continues, and they feel that they've developed strong friendships with other participants in the group. So it goes back to your question about how do they stay connected after the program concludes. The other thing that the program, obviously with staff there, we're able to refer families to other services within the UnitingSA portfolio. And the play group in the creche offers additional support for mum and baby, just to look at the developmental milestones and whether baby's achieving those, and providing mum with support and referrals to other services should they be required, really in a non-judgmental way, so mum can get that support that she needs in a really timely way.
Right, thank you. There are two statements in the chat that we could either take as very precise questions or invitations to think more broadly. I'm going to take them as the second of those. So Stephanie asked a little while ago if Uniting across its various jurisdictions is planning to expand its engagement in early childhood hubs and child and family hubs. And there are lots of communities where they could work, where Uniting in its various guises across the states and territories has a presence. I think the in principle answer is probably yes. We think they're good things. But I'm interested in hearing, and I'll start with you, Natalie, around where you see the opportunities in the parts of Australia that you work in to do this, and where you see the benefits of that being. Would you like to expand on why?
Yeah, look, we've explored and in the middle of trying to explore like where we can support, I guess, our early learning centres around accessing the program within those spaces. We also have a number of sort of housing areas that potentially the early help program can support the residents of those housing facilities. So we're sort of exploring where we can expand into that that space as well. Yeah. So there's definitely areas within Uniting that we support families that fall into that missing middle sort of category, that we would love to be able to expand our program into supporting in those areas.
Lovely. Courtney, and then Nicola and Kitty to answer the same question as our last question of the day. Courtney.
So we're currently, this program in particular is a pilot program, and we're funded until 30 June. So we are we would love to expand across anywhere in New South Wales, to be honest. We have a number of linker, navigator, key worker programs in southwestern Sydney, and we've learnt so much around how we can equip services as well as families with information that they need for different families that they're intercepting with and how to navigate the service system. So I think we do that incredibly well, mildly biased, but I think we have so much to share with other parts of New South Wales and across the country, really, around what we know from our linker and navigator models, and how we've seen the outcomes for not only families but also service providers, and their increase in their capacity and their confidence to have conversations with vulnerable families.
Thank you. Nicola and Kitty.
Thanks, Tom. Very similar to Courtney's comments. We'd love to expand this program, and particularly in rural and remote locations where we don't see a lot of investment, and certainly mums in those locations have, I think, different challenges. We've just recently commenced a partnership with Vic.Tas in Whyalla for them to run a playgroup at one of our community centres there. And so we are, I guess, being a little bit creative about how we might look at expanding this program, and we'll try and the aim really is to consolidate the playgroup at the moment, but then down the track might look at expanding to include a program such as this in partnership with obviously the health network and the local community. This program really at the moment focuses in Adelaide's western region. I think there's definitely a need. We're sort of located and predominantly provide services in the sort of Port Adelaide region. So I think, there would be absolutely opportunity to expand. And, we'd be looking at that as a possibility moving into the next, I guess, round of tenders for the Communities for Children program as we approach 2027.
Thank you so much. We are almost at the end of our time together, everyone. I'd like to offer one concluding observation, which is that the village has untapped potential for the way that we provide support to families who are vulnerable or struggling. At the moment, social policy basically uses the village as an opportunity to get to these families. It's a useful thing, but not necessarily a thing to honour in its own right. But I think we've heard two other things today. The first is that services can be effective where they take the village as an inspiration for the way to work. We work in ways that are patient and long-term and relational, and fundamentally about empowering rather than delivering a set of activities against a checkbox. And the second is that families are better off in the long term when we help them to find their own village, when we help them to become embedded in local communities, to find those at similar stages of life and to share experiences with them. I'd like to thank our four speakers today, Natalie, Courtney, Kitty and Nicola. Thank you for sharing your experience and for answering my questions, even if some of them came at you a bit out of the blue. And thank you to all of you as participants. I'd like to leave you with a call to action. We all created the Uniting Families report, not just for our own advocacy, our own innovation, and our own practice improvement, but as a resource for the sector. So we'd love for you to use it. Please get in touch with us if you'd like to work with us on it, and please get in touch with us to tell us how you've used it. You can access the report, as you've seen in the chat, at uniting.org/families-report. That's a bit of a mouthful. We'll send you details of that after the event, so you don't have to transcribe my butchering of it. And we'll also write to you to hear how you found today's event and to tell you about future events on the Families Report. Thank you, everyone, and we look forward to hearing from you soon.